The ECHO study was designed to assist in the recovery from the COVID-19 pandemic. The pandemic has created unprecedented challenges for healthcare providers. An interprofessional research team from Georgian College, Waypoint Centre for Mental Health, and the Royal Victoria Regional Health Centre collaborated on ECHOs. We explored healthcare provider wellness and how the pandemic was influencing clinical practice and interprofessional collaboration. We also asked about the types of education and support that would assist with pandemic recovery. The study included participants who worked in either a large psychiatric hospital or a large acute care community hospital. 239 healthcare providers completed 5 different standardized tests to assess depression, anxiety, and stress, work-related quality of life, resilience, anxiety about COVID-19, and loneliness. 30 people were involved in one-to-one interviews, and 88 people completed open-ended online questionnaires. The results tell us that about half of the healthcare providers are doing well and coping, while the other half are struggling with anxiety, depression, low quality of work life, and low resilience. The ECHO study revealed that a significant source of distress came from witnessing the devastating effects of loneliness, mobility restrictions, social distancing, and PPE on patients. The infection control measures also limited the supports healthcare providers could give to each other. Work can feel like a grind without these informal social structures. This is compounded when healthcare providers go home and must cope with fear of spreading COVID to their families and deal with added family responsibilities such as homeschooling. The ways that policies were communicated and the policies themselves had unintended and negative consequences for healthcare providers. Healthcare providers wanted to use their expertise and contribute to policy development, implementation, and evaluation. They were certain that their expertise could ensure that the least restrictive measures were taken, which would mitigate some of the harmful effects of the policies. Healthcare providers also want to engage in health system innovations and education to create new methods of delivering care. Interprofessional respect and collaboration became stronger during the pandemic. Interprofessional collaboration is a strength that can be leveraged during health system redesign and pandemic recovery. Addressing the profound effects of the pandemic on the practice environment can assist healthcare providers to restore health and wellness and meet patient needs. The ECHO study has implications for leaders and policymakers. Empathy strain can lead to burnout, and healthcare providers require support to address this. Recognizing the interconnections between the patients and healthcare providers' experiences is an important first step. Healthcare providers need support to develop additional therapeutic competencies to address new and emerging patient care needs. Interprofessional collaboration is a strength here. Ensure that those closest to the patient care can share insights on care design and policy. Engage in regular assessments of healthcare providers using standardized testing to monitor wellness and the effects of any initiative aimed at improving the situation for healthcare providers.